Hi guys, welcome back to the channel. If you're new here, my name's Nosa. I'm a medical doctor in the UK and I make videos on medicine and lifestyle. In today's video, I'm going to be talking to you guys about how doctors diagnose and treat depression. I think everyone would find this video helpful not only for themselves but also in recognizing the symptoms in family or friends. It's not something you want to miss. You want to be able to support them, and also knowledge is power. Speaking about knowledge, I'd like to thank today's video sponsor Skillshare for kindly sponsoring this video. Skillshare is an online learning community with thousands of inspiring classes for creative and curious people. It's a great way to explore new skills, expand your knowledge, and get lost in creativity. If you're a student or even a doctor like me, you would know we have to take exams regularly to progress through training. And I found this helpful, amazing class that I cannot honestly recommend enough, and I've taken myself, by another medical YouTuber called Ali Abdal. It's called How to Study for Exams, an evidence-based masterclass. He speaks about active recall, how to use active recall and spaced repetition to study for your exams, how to take notes, basically all the information you need to study the most effective and efficient way to get the best grades possible is in that masterclass. So guys, go and check it out. The best part about this today is I've got a free trial for you guys to check out today from Skillshare. The first 1,000 people that use my link down in the description box below will get a free trial of Skillshare. And thereafter, it's only less than $10 a month on an annual subscription. So let's talk about how doctors diagnose depression. Let's just quickly define depression. Depression is a persistent feeling of sadness, hopelessness, and just general loss of interest in activities that perhaps the person in question used to enjoy. Depression is diagnosed by doctors using the DSM-5 criteria. In order to be diagnosed with depression, you need to have 5 or more of the following symptoms over a 2-week period, and at least one of those symptoms should be either low mood and or loss of interest in activities that the patient in question used to find pleasurable. That is known as anhedonia. In terms of what the 5 symptoms that are required for the diagnosis of depression, there's a mnemonic I learned in medical school called SIGECAPS, S-I-G-E-C-A-P-S. The S in SIGECAPS stands for sleep. People with depression tend to notice that they're sleeping a lot more than usual, and sometimes a lot less than usual too. The I in SIGECAPS stands for interest. People with depression sometimes notice that they've lost interest in activities they used to once enjoy. The G in SIGECAPS, another symptom of depression, stands for guilt. People with depression sometimes find that they're feeling guilty about things that have happened in their past. This tends to be common in older people as well, where they sort of devalue themselves and kind of feel this excessive guilt. The emphasis is on excessive about decisions perhaps they've made in the past. The E in SIGECAPS stands for energy. A common complaint with depression is feeling very fatigued, feeling very weak, which is why when patients come to the doctors with the symptom of fatigue, one of the differentials that the doctor would want to rule out as the cause of the fatigue is depression. The C in SIGECAPS stands for concentration/cognition. People with depression find they might have difficulty concentrating as well as they used to, and this can also lead to poor memory as well. The A in SIGECAPS stands for appetite, and this also is combined with weight loss. So people with depression might notice that they're eating a lot less than usual because of how low they feel. Some people might notice that their appetite actually increases as well, and they're eating more than usual to try and compensate for that low mood too. And this might lead to changes in weight loss, or basically weight gain. P in SIGECAPS stands for psychomotor. So people with depression might notice they're a lot more, we call it psychomotor retardation, a lot more slower, not as fast as they used to be. Or some of them might actually have the opposite effect and just find they're always like, you know, agitated, sort of like an anxiety sort of state. And the last letter, S in SIGECAPS, stands for suicide. Now, this is a very, very important question for every doctor with regards to diagnosing a patient with depression. Are they having thoughts about taking their life? Your doctor is going to want to take a detailed history to rule out other conditions that can present like depression. So for example, substance misuse. People that smoke quite a lot of weed or cannabis, I know it's being sort of, normalized in society, but honestly, there's been studies that have shown a strong link between smoking cannabis and mental illness, including depression. Using anabolic steroids, which sometimes some bodybuilders do, or using cocaine as well, has been shown to present like depression symptoms. So in terms of those patients, one of the ways of managing that scenario would be to try and get them off whatever substance they're using. Another important point here is to make sure that the person that is presenting with depression symptoms does not have episodes where they have mood elevation, like really high mood elevation, where they're just acting very hyper alert, their speech is very pressured, they seem very anxious, because they sort of seem all over the place, because that could mean that depression is presenting as part of a condition called bipolar disorder. And it's important to get the diagnosis right, because the treatment of bipolar disorder is different to the treatment of depression. In bipolar patients, we tend to use a medication called lithium. If the person with depression is now presenting with symptoms of hallucination, so they're hearing voices where no one else can, they're having delusions about certain things that haven't actually happened, then we need to be thinking about another diagnosis or a type of depression called psychotic depression. Again, the management of this is different, because sometimes these patients are actually treated with antipsychotics as opposed to antidepressants. Another important point with regards to what information your doctor would want to get from you is about perhaps your work, your finances, if there's any domestic violence, because all these things can contribute to depression. When you go and see your doctor, your doctor is actually going to be studying you up and down, going to be looking at you. What's your eye contact like? What's your speech like? What's the tone like? People with depression tend to have this, sort of low voice, wanting to avoid eye contact. Some of them even coming crying. You might find they're just very slow. We call this psychomotor retardation. That is how we examine patients with regards to diagnosing depression. Blood tests are sometimes useful in diagnosing depression. So sometimes your doctor might request a blood test, not because there's actually any blood test to diagnose depression, but to rule out other conditions that can present like depression. A common condition that can present like depression is called hypothyroidism. The thyroid gland is in the neck, and hypothyroidism basically means the thyroid gland in the neck is not producing as much thyroxine hormone as it should. And this can sometimes make people feel a bit low. They find that they gain weight. Again, these are similar symptoms to depression. So let's talk about how doctors treat depression. Depending on how severe your symptoms are, so how basically we determine severity is really how it's impacting your life. Someone can have the same symptoms as you but be able to function better than you. So it's not so much about the symptoms, but how much is affecting your quality of life. Can you still go to work? Can you still leave the house? Can you still socialize? So one of the solutions we offer is actually counseling. Some patients find this helpful, talking to someone, and they also get strategies and techniques from their counselors on how they can manage their depressive symptoms in the future. Another thing we like to offer sometimes in some patients is medication, antidepressants. The first line of medications we consider for most patients suffering from depressive symptoms in the UK is a group of medications called SSRIs. For example, Prozac is an SSRI, which is fluoxetine, or sertraline is a common one, or citalopram. With depression medications, it's sort of a trial and error thing. Some people just don't get on well with a certain medication, and we have to switch them to another and another until we find the right dose and balance for them. Last thing we like to think about is lifestyle changes. Now, this is a point that I cannot emphasize enough. There's a lot of evidence to show that lifestyle changes actually make a huge difference when it comes to depression symptoms. One of the lifestyle changes I'm talking about here is exercise. Exercise has actually been proven to lift your mood as much as even taking depressants sometimes. The recommended guidance for exercise is 150 minutes a week, but if you haven't exercised in a long time, you can start off by doing 10 minutes a day and working your way up. One thing I can tell you for sure is exercise can lift your mood, encourage the release of endorphins, relieve stress and anxiety. There's just so many benefits from exercise, so don't be surprised if your GP refers you for a group exercise class. The next important lifestyle change is diet. A healthy diet can actually lift your mood. In fact, a healthy diet has been shown to be just as important for your physical health as it is for your mental health. One I really enjoy, and I find that it's helpful for patients as well, is mindfulness. Mindfulness is all about paying attention to the present moment, observing things around you, focusing on now and less about the past and less about the future. Mindfulness is actually recommended by NICE in the UK for the prevention of depression in people who have had 3 or more episodes in the past. I just want to quickly mention one important thing is that a lot of people are in jobs that are making them feel depressed, as work or even their financial situation. Now, if you're in a job that is making you feel depressed, you can actually see your GP to talk about perhaps taking some time off. You don't want to take time off for a prolonged period of time because there's actually evidence to show that taking a lot of time off work actually worsens depression in the long run. So it's okay to take a bit of time off work to get yourself together, but you don't want to be taking too much time off because at that point you should probably be thinking about perhaps changing jobs. If you're unable to work as a result of your depression, which I've actually seen quite a bit in the UK, then you may be eligible for some benefits in the UK. Anyway guys, I hope you guys found this video helpful. It is obviously not a substitute for medical advice from your own doctor, but I just thought it was important for you guys to know and perhaps recognize the symptoms of depression in yourselves or family or friends. That way you can point them in the right direction about seeing their doctors for further help. So thank you guys anyway for watching this video again. If you really enjoyed it, give it a thumbs up. If you're new to my channel, please subscribe. I would love to have you guys back for more videos. Thank you guys so much.